Histogram interpretation, case discussion. Let us examine a few examples of histograms to understand the interpretation of some common pathologies. Let us take example 1. Here, the readings are as follows. RBC count 4.25 into 10 to the power 12 per liter, HB 8.4 grams per deciliter, HCT 27.3%, MCV 64.2 FL, MCH 19.7 picograms, MCHC 30.7 grams per deciliter, RDWC 18.7%, PLT PU 235 into 10 to the power of 9 per liter, PDW 11.7 FL, MPV 9.4 FL, and PLCR 21.7%. First, let us examine the numerical values which are showing low hemoglobin of 8.4 grams per deciliter and low hematocrit of 27.3% indicated by a minus sign. It also shows a low MCV at 64.2 FL and low MCH at 19.7 pg, again indicated by a minus sign, indicative of microcytosis and hypochromia. The RDW is 18.7%, which is high, indicating anisocytosis or a varying RBC size. The numerical values are suggestive of anemia with microcytic and hypochromic cells as well as anisocytosis. The platelet count is showing the flag of PU, that is upper discriminator flag, probably due to the microcytic RBCs interfering with the platelets at the upper discriminator. So it should be examined on smear. The most likely differential diagnosis will be iron deficiency anemia. Microscopic examination of a smear and serum iron studies can be done to confirm the diagnosis. Now let us look at example 2. Here the readings are RBC 7.8 into 10 to the power of 12 per liter, hemoglobin 12.6 grams per deciliter, hematocrit 39.0%, MCV 50.1 FL, MCH 16.1 picograms, MCHC 32.3 grams per deciliter and RDWC 14.7%. In this example, the numerical values show a high RBC count of 7.8 into 10 to the power of 12 per L. MCV, MCH and MCHC show low values indicated by the minus sign, suggestive of a microcytic hypochromic picture. However, the RDW is abnormal here. Enhanced erythrocyte count and low RDW is often seen in thalassemia minor. The numerical values are suggestive of thalassemia. Microscopic examination of a smear along with hemoglobin electrophoresis would be required for confirmation of this diagnosis. Let us look at example 3. The RBC count is 1.72 into 10 to the power 12 per liter. Hemoglobin is 6.7 grams per deciliter. Hematocrit is 18.7%. MCV is 91.9 FL. MCH is 38.9 pg. MCHC is 35.8 grams per deciliter. RDWC is 15.2%. As you can see, the WBC count is 51.4 into 10 to the power of 9 per liter and the lymphocyte percent is 12.4 grams per deciliter. The mixed cell population is T2 and neutrophils is also T2. The numerical values on the histogram shows an increased WBC count, which is indicated by plus sign and means leukocytosis. It also shows flagging of T2, which means inability to differentiate between mixed and large white blood cells. The WBC graph is broad and shifted towards the right, which is suggestive of large white blood cells. A peripheral smear must be examined to rule out the presence of any abnormal WBC cells. The RBC indices show a low RBC count, low hematocrit and low hemoglobin levels, all suggestive of anemia. However, the MCV value of 91.9 FL is high, indicated by the plus sign, which suggests a macrocytic anemia with leukocytosis. Peripheral smear must be examined to support this diagnosis made on the histogram. Here, due to the presence of large immature WBCs, a diagnosis of CML with a macrocytic anemia was made and it was corroborated with the clinical picture of the patient. Example 4. Here, the total leukocyte count is increased, shown with a plus sign. There is increase in the neutrophil percentage and the absolute neutrophil count, which is corroborated on the WBC histogram, which shows a prominent peak in the large leukocyte cell region, which are the neutrophils. Peripheral smear must be examined to rule out any immature cells and to confirm the diagnosis of a reactive neutrophilia. And also, this should be corroborated with the clinical history of the patient. Example 5. On examining the numerical values, we can see that the platelet count is low with a value of 82 into 10 to the power of 9 per liter. Also, the platelet distribution width is increased. The platelet histogram is jagged and wide, suggestive of large platelets. The WBC histogram shows a peak in the ghost area, but no WL flag, indicating that the WBC count is not affected. AG flag is seen on the platelet result, that is, large number of particles are detected in front of the lower WBC discriminator. Platelet aggregation is suspected, which can be confirmed on the peripheral smear examination.